Hey guys, I am Dr. Victoria Munoz, and this month we are doing a series on stem cell and regenerative type treatments. We've already done a video on prolotherapy. Last week we did one on PRP, which is platelet-rich plasma, and today we're doing a video on stem cell and stem cell-like treatments. So let's start with discussing what regenerative medicine is. A lot of you come here wondering, what is regenerative medicine? It's a relatively new specialty in the United States. Stem cell and stem cell-like treatments have only been legal in the United States for about 7 years, but these treatments have been done for decades in Europe, and professional athletes used to go to Europe to get these treatments because they knew that it extended the life of their career as well as healed and repaired soft tissue injuries. So what is regenerative medicine? Regenerative medicine is a specialty area of medicine that utilizes treatment strategies to rebuild and regrow tissue. The goal is to replace tissue or organs that have become damaged versus current clinical strategies that focus primarily on treating symptoms. The tools used to realize these outcomes are pluripotent mesenchymal stem cells, and by using these applications, we aim to restore structure and function of the damaged tissue. So what are stem cells and from where do they come? So stem cells are unspecialized cells that become specialized through a process called differentiation. In other words, these cells have the ability to become any cell in the human body. So from where do we get these stem cells? There are several methods of providing stem cells for the purpose of regenerating damaged tissue. We have autologous versus allograft tissue donation. So method number one, autologous tissue donation. Adipose tissue or fat cells or bone marrow is harvested from the patient's own body and reintroduced back into the injured body part through an arduous process. Bone marrow is harvested by drilling into bone, typically the iliac crest or the femur, and adipose tissue is harvested through liposuction. Now, method number two, allograft tissue donation. This is amnion-derived tissue, which comes from the placental membrane of donated placentas. And I use method number two, and here is why. So we've got pluripotent versus multipotent cells. So amnion-derived tissue is pluripotent. Pluripotent cells have powerful regenerative potential because they have not yet differentiated. When cells become multipotent, such as the cells in an adult body, they have already differentiated several times and have limited regenerative potential. So fat cells and bone marrow are multipotent cells, and we want pluripotent cells for the best clinical outcome. So in terms of product, amnion-derived allograft is placental membrane, and the placental membrane is made up of two layers, the chorion and the amnion. The chorion is the outermost layer closest to the mother, and the amnion is the innermost layer that's closest to the developing fetus. Okay, so the amnion, traditionally considered a byproduct of pregnancy, the amnion is the layer that has become highly attractive for cellular repair and regeneration. And the amnion consists of three layers: the amniotic epithelium, the basement membrane, and the avascular stroma. And for those of you that are not doctors or medically trained, that might not mean anything to you, but let's just break it down like this. The cells of these layers are mesenchymal and pluripotent in nature, meaning that they differentiate easily. This means that these unspecialized cells become specialized, and pluripotent cells give rise to all the cells that make up the human body. So these cells will become the same cells as those to which they are exposed. And what this means for regenerative medicine is that these cells will grow new bone, new cartilage, new tendon, ligaments, muscle, blood vessels, nerve, and much, much more. Okay? So by applying amnion-derived allograft to an injured area, we're able to grow new tissue and rebuild that area back to its functional state. So what are the benefits? Okay, so these cells do not contain antigens and therefore are not recognized as foreign by the donor recipient. thus avoiding the risk of tissue rejection by our own antibodies. So, like for example, if you needed a heart transplant and you received a donor heart, that heart, the cells that make up that heart, have antigens that are specific to the donor, not the recipient. So what happens is the recipient's immune system will start to reject it, realizing that it's not a part of you. So with these cells, with the amnion, there are no antigens on these cells, therefore there's no risk of rejection of the donated tissue. There's no downtime for the patient once they've received this procedure, and you can resume normal activities following the procedure. There are no ethical issues with donated placental tissue, as the placentas are donated by mothers who are scheduled for C-section deliveries. So the tissue then goes through a series of tests to ensure its purity, and then the medical application of amniotic membrane tissue is highly regulated by the FDA. So what conditions can this amniotic-derived allograft treat? Well, I have a list. Degenerative disc disease, osteoarthritis, disc herniation, acute injury, strains and sprains, tendinitis, tenosynovitis, which is de Quervain syndrome, bursitis, burns, wounds, ulcers, diabetic wounds, and much, much more. So, not all stem cell products are made equally, and let me explain. There are companies out there that are boasting live stem cell contents in their product. This is absolutely unnecessary. And the reason for this is because the live cells in the product make no difference. The cell is simply a carrier of the proteins that do the regenerative work. So when you have a live cell, inside that cell is growth factors and cytokines that actually do the regenerative work. So when you take a product that has live stem cells, you inject it into, let's say, an injured shoulder, those cells die, releasing the proteins and cytokines, the growth factors and whatnot that do the regenerative work. So the cell is just a carrier, it's not necessary, and a lot of these live cell products are very, very tedious to maintain because it requires a cryo tank to be cryopreserved. You remove these products from the cryo tank, you have a very, very small window to when you can inject it before these products start to go bad. Excuse me. The product I use is just the growth factors and cytokines that come from these mesenchymal stem cells. It is terminally sterilized, and it does have a shelf life of 1 year. It is highly, highly effective. Also, you got to be careful about companies and clinics that are claiming that they're getting their products from Mexico. The problem with this is they're claiming that these products are FDA regulated. Nothing outside of the United States is FDA regulated. Let me repeat that. Nothing outside of the United States meets FDA standards. So these companies, these clinics are going to Mexico, getting really cheap stem cell products, and they're using them on their patients here in the United States. They're able to charge pennies for their treatments, but there's no guarantee that you're getting a safe and effective treatment. So what is your next step in terms of you and your regenerative medicine needs? Well, I do 15-minute free consultations with anybody who has further questions about anything in regenerative medicine. You can go to my website at drvictoriamunoz.com. You can see what kind of treatments that I do. If you already know what you want and you want to set up an appointment for a new patient visit, you can go to the description above. You can go to my website and request an appointment, or you can call the number that is in the description and schedule your appointment today. Hey guys, I want you to like this video and subscribe to my channel. If you subscribe to my channel, you will get 10% off your new patient visit, and there are significant discounts to look forward to as well. So hey guys, this is a wrap. That is an overview of what stem cell and stem cell-like treatments have to offer. Again, if you want to talk to me, just schedule a 15-minute free phone call, and I'm happy to discuss further details about these treatments. Now, this 15-minute call is not specific about your treatment. and your diagnosis. It is just kind of informative. And then again, if you want more specific attention on your situation and your issue, then schedule an appointment with me today. So hey guys, this video is going to be uploaded on YouTube. So thanks for watching, and hey, I'm your regenerative doctor. Have a great day.